Welcome to the Deep Dive. Today we're looking into a set of sources provided by one of you, our listeners. We've got writings, including an autobiography from Dr. Srivatsa.
That's right. And it's more than just his life story.
Oh, definitely. It maps out this journey, really driven by things that happened early on, which seem to have sparked this, well, incredible determination.
A determination to basically shake up healthcare, to
Yeah.
innovate in a way that's really aimed at protecting humanity, you could say.
We'll explore how certain moments really fueled that.
And we'll look at his big innovation, Dr. Maya GPT, and how it's meant to fix what he saw as major flaws in the system.
Flaws he experienced firsthand, it sounds like.
Yes, and there's also this interesting bit in the sources, a connection mentioned between his work, ChatGPT technology, and quite surprisingly, the ancient physician Charaka.
So for you listening, our goal here is to really get under the skin of what drove this doctor, his whole life's work, and what his approach might practically mean for, well, for your health and for all of us.
Yeah, get ready. It's a fascinating mix, childhood lessons, tough professional fights, and some really cutting-edge AI, all coming together in this one mission. Let's get into it.
Okay, so digging in. The sources take us way back, childhood stuff, and some moments really stand out as, well, formative. Like his early exposure to these philosophical debates.
Yes, the Naya debates. He apparently watched relatives arguing using the system. It's this ancient Indian logic focused on, how you argue, how you know something is valid knowledge.
Structured thinking, basically.
Exactly. With steps like stating your case, giving a reason, an example, that kind of thing. You can sort of see how being around that, thinking about thinking, might shape someone who later tries to unravel complex systems like healthcare.
The logical underpinning seems key. But then there's this really visceral story, almost the opposite of abstract philosophy, his first hands-on health lesson.
Oh yeah, the bleeding one. It's quite stark.
He learns this simple thing, apply pressure.
Mm-hmm.
And the source says he had to use it, like, immediately after learning it.
Right. His younger brother swings a sharp blade accidentally and takes a big chunk out of his little sister's arm. She's only 3.
Oh, wow.
And apparently she wasn't even crying at first, but he just reacted, used the pressure technique he just learned. It's such a, brutal and instant lesson in how vital practical knowledge can be right then and there.
Terrifying. But what a way to cement a life-saving skill. And then there's another big childhood moment, malaria, when he was about 6.
Yeah, this seems absolutely crucial to his path. He describes being really sick, the fever, chills, aches, even nightmares.
His parents tried things at home.
They did, but nothing worked. He just got worse. So they took him to a doctor. And the key thing the source highlights is that this doctor listened, didn't rush, just listened carefully to his story, his symptoms.
And based on that listening,
diagnosed malaria, gave the right treatment, and he got better.
So that direct experience being properly heard leading to the right diagnosis contrasted with what might have happened that planted the seed.
It seems so. The source explicitly says this. Seeing the difference that doctor made, thinking about the alternative, it made him realize. From then on, the idea of patients not being heard, not diagnosed right, that became his mission. He apparently vowed, even that young, to make a difference. It's a straight line, really.
The sources also touch on his school days, feeling a bit like an outsider at first, teased.
Yeah, mentions being a bit of a loner in one school, teased for wearing a tilak, maybe not fitting the usual jock or nerd boxes.
He adapted.
Seems like it. It points to some resilience, and then contrasts it with medical school, where he apparently became quite popular. Bobby Vatsa, they called him, because he had this car and bike from a film.
Huh, okay. So maybe learning early on how to navigate different social scenes, find his footing.
Could be. Developing that adaptability, maybe drawing on those early feelings of being different.
Okay, let's fast forward to his early career. He starts as a family doctor.
Yes, and initially offered free care. The sources say people were really grateful for that. Seems like that direct patient connection, providing accessible care, was important early on.
But that satisfaction didn't last long after graduation.
No. The sources talk about this growing unease. He saw colleagues, many of them just focused on increasing their cash flow. That's the phrase used. Not really interested in research or improving care quality.
A clash of values.
Big one. It made him really uncomfortable, didn't align with his own goals at all. So he started looking elsewhere, which eventually led him to the UK. And his goal there, specifically, was to create some kind of simple tool to tackle health inequalities, cut down on consultation costs.
And his experiences in the UK seem to have really sharpened his critique of the system.
Definitely. There are a couple of striking examples. One case involved a young boy really sick with a fever, but no one could figure out why PUO, pyrexia of unknown origin. He says the other doctors were stuck, but he made a diagnosis just by examining the child closely, a SMOT diagnosis. And he stresses in the source, would have died if I had to take the risk. Meaning the risk of not trusting his clinical examination skills over just, say, ordering more tests.
Emphasizing that hands-on observation.
Exactly. And that links to another story, a lesson from someone called Halliday Smith.
What was that?
He was told quite directly, examine the child, not auscultate first, meaning look at the patient, see their physical signs, before grabbing the stethoscope. Prioritize that basic clinical assessment.
So these specific instances highlight potential pitfalls, but he was also seeing bigger systemic problems.
Oh, absolutely. It wasn't just individual errors. He talks about doctors being hemmed in by prescribed protocols and procedures, often designed for cost saving, even if it meant not doing the absolute right thing for the patient.
And issues with personnel.
Yes, critiquing the use of unqualified medical personnel for tasks they shouldn't be doing, and also the abusive prescriptions of antibiotics, which he saw as making things much worse.
Which circles back to his core belief about the patient's story being central.
Yes, that's a constant theme. His firm belief that diagnosis has to start with their stories as they have lived and experienced them, not just ticking boxes on a protocol or assuming one patient is like another. The individual narrative is key.
And this is where his concern about antibiotic resistance, MRSA, superbugs, really intensifies.
Right. This became a huge red flag for him. He was seeing children die from infections that just didn't respond to treatment anymore. He understood bacteria were sharing resistance, spreading it person to person, leading towards, well, potential pandemics. He felt the world wasn't taking this significant crisis for humanity seriously enough.
And the rigid protocols were connected to this frustration.
Deeply. He describes feeling angry about these pre-printed assessment sheets and protocols that claim to be evidence-based. His point was, if a doctor followed the sheet rigidly, even if the patient died as a result, the doctor might be cleared of negligence because they followed procedure.
Devaluing actual clinical judgment.
Exactly. He saw it as a major blow to our profession, replacing critical thinking with a checklist mentality.
Which leads us into a really difficult period described in the sources, the fallout, when he started raising these concerns openly.
Yeah, this is where things get incredibly tough for him personally.
Yeah.
He flagged errors he saw being made by nurses in walk-in clinics, nurses acting, in his view, beyond their competence. This put him in direct conflict with the management, the PCT, and the nurses themselves.
And the response was severe. The sources mentioned punitive sanction, unsubstantiated claims.
That's what he describes. An investigation launched that he felt was designed purely to discredit me and destroy my passion, and it wasn't quick.
It dragged on for years.
More than 2 years, according to the source. The toll was huge. He talks about being psychologically traumatized.
And financially devastating, too.
Yes. His pay was stopped, even though he was technically still employed. He became bankrupt and penniless. The family had to move to Germany because of the stress, leading to a family breakdown. He even mentions finding it hard to trust people after all that.
It sounds absolutely crushing. But the sources suggest it didn't break him. If anything, it strengthened his resolve.
That's exactly how he frames it. He writes quite powerfully that the whole ordeal has made me into who I am today. It made him tough, gave him that fighting quality, strong willpower, and prepared him to face hard times without fear, but rather with confidence.
So even when pressured, told to quit, feeling the NHS was trying to tame him, he didn't back down.
Not at all. He says explicitly, stuck to my gun and refused to change my belief for anyone. The fight went on for years into the courts, and the sources state that High Court and Supreme Court judges actually supported his claim, acknowledging him as a whistleblower. He notes an attempt by the Secretary of State to dismiss his case on a technicality was blocked by the court.
So these struggles, born from the very system issues he saw, really fueled his drive to build a solution.
The sources make that link very clear. The desire to systemize healthcare so no one suffers unnecessarily, combined with what he went through personally and professionally, that's presented as the engine behind his innovation.
Which brings us to Dr. Maya GPT. But it wasn't created overnight, right? It evolved over time.
Yes, the sources trace it back much further, to the early 80s, actually, with something called the Pediatric Assessment Tool, or PAT-B. Initially just an algorithm, maybe on cards.
Low-tech.
Very. Then later, software for early PDAs, those handheld computers. And even before that, visual tools like a Maya fridge magnet, wheels, a wall chart, all trying to help people grasp basic health concepts.
And MEA stood for Medical Advice You Access.
That was the original acronym, yes. The first goal for MEA was relatively modest. Help receptionists or nurses quickly sort patients, figure out who was mildly ill versus seriously ill to get the urgent cases seen faster.
But then technology caught up.
Exactly. The rise of powerful AI allowed him to take that core idea and expand it massively into what Dr. Maya GPT is described as today.
So how do the sources describe its main purpose now?
It's positioned as the result of his life's work. An AI-powered assistant built to help people understand basic health issues, feel less anxious, maybe shorten doctor visits. But the big overarching goal stated is stop the spread of infection.
And reduce inequalities too.
Yes. He calls it a simple tool to help reduce the social inequalities in health, offering free basic advice to cut down on unnecessary, costly consultations.
Okay, let's focus on how the sources say this actually empowers you, the person using it.
They describe it as an AI that understands illness the way doctors do, but crucially, speaks in a language anyone can understand. That accessibility seems paramount.
Making complex medical knowledge understandable.
Exactly. The aim is to help you recognize signs of infection early, to help you decide when to isolate or seek help, and really importantly, help you understand if a problem is minor or serious.
Because differentiating can be hard.
Very hard, especially early on. He notes that the first symptoms of really dangerous superbugs might look just like a mild cold or flu. Making that distinction early is vital.
And there's that feature about communication, even if you can't read or write.
Yeah, that's a powerful aspect, aimed right at inequality. It's designed to help you communicate with doctors, nurses, or even government officials without knowing how to read or write. He frames this as giving you back control, your voice, your health, your power. It also mentions using a simple color code system for easy understanding.
So it empowers the individual, but there's a clear public health dimension too.
Oh, absolutely. A huge part of the design is about identifying infected people early, helping people know when to isolate an infected person to protect family, friends, and loved ones. The initial thought was empowering households to do this first, protecting their immediate circle.
And that local action scales up.
That's the idea. Early identification and isolation at home, stopping transmission there, prevents wider spread. It also means fewer contagious people going to clinics or A&E departments where they could infect others, including healthcare workers.
Projecting the protectors.
Right. He explicitly says preventing those visits will protect the lives of doctors, nurses, and the general population. He even sees Dr. Maya potentially acting as a gatekeeper for hospitals, helping to head off epidemics, maybe even pandemics.
And there was one more, quite specialized function mentioned, identifying abuse.
Yes, that was interesting. The sources say he specifically trained the underlying ChatGPT model to recognize signs of abuse, mental, physical, emotional, and to identify potential victims like vulnerable adults or children, and also potential perpetrators.
With the aim of helping professionals.
Yeah, the stated goal is to give doctors, social workers, relevant agencies a tool to help them spot risks and take necessary action.
Okay, and this is where that Charaka reference comes in. How do the sources explain that?
Well, one document specifically mentions Charaka's method and Dr. Maya discussion with ChatGPT. It indicates that ChatGPT was used in training Dr. Maya GPT, and somehow this process or the discussion around it drew a parallel or connection to this ancient Indian physician, Charaka.
And this came up in a specific context.
Yes, the source links it to discussions about convincing leaders and tackling issues around fear and free will.
So the source confirms a link was made, Dr. Maya, ChatGPT, Charaka, within conversations aimed at influencing leadership on matters of fear and choice. But it doesn't spell out the exact comparison or argument used.
Correct. It tells us the connection was drawn, and the general context, convincing leaders, fear, free will, but not the details of how Charaka's methods were seen as relating to Dr. Maya, or what the specific arguments to leaders were based on that comparison. We just know the source states this link and context exists.
Got it. And underpinning all this innovation and struggle is a core philosophy that comes through in the sources.
Yes, a really fundamental belief. The knowledge of health is a knowledge of life. And because of that, sharing it is vital. He calls it the best I can give before I die.
And this ties into dealing with fear.
Directly. He sees fear as just an emotion, something that can be managed, maybe even manipulated. A key aim for him and for Dr. Maya is to help people conquer the fear and stigma around the infection.
Moving people from fear-based reactions,
like rushing to the doctor for every little thing out of anxiety.
To making informed choices based on actual knowledge.
Exactly. Which leads to this idea of shared responsibility.
The protecting you, protecting us mantra.
Right. The idea that we all have an important role to play in maintaining health, both individually and as a society. Empowering you, the patient, with knowledge isn't just good for you. It eases the burden on the whole system, saves time, saves money, and makes everyone safer.
So looking back across these sources, it's quite a narrative. Starts with this curious kid learning vital lessons, seeing flaws in the system early on.
Them facing these incredibly intense personal and professional battles, which, as the sources frame it, didn't deter him, but actually forged his resolve.
Leading to Dr. Maya GPT, an innovation envisioned not just as a health tool, but as a way to empower people with knowledge, fight fear, and maybe even act as a defense against widespread infection, connecting modern AI back to discussions involving ancient wisdom.
Yeah, Dr. Srivatsa's journey, as laid out here, really underscores how powerful individual experiences can be in shaping a life's work. That determination, born from seeing problems and facing adversity, combined with a deep medical understanding and insight into human vulnerability, it all drove this push for innovation to tackle really significant global health issues.
And what this deep dive hopefully shows you, the listener, is this vision where having accessible knowledge truly empowers you to better manage your own health, understand illness, make informed decisions, and play a part in your community's health, too.
Makes you think, doesn't it? What if everyone really had access to clear health knowledge they could understand and act on? How might that shared understanding, that sense of collective responsibility, truly change how we approach healthcare and face future health crises together?